In our previous sessions, we've talked about both non-state actors and the UN, and we talked about governance. Now we're going to talk about how global health is financed. The activity or work that occurs in global health has to be financed. And there are a lot of institutions that finance global health. Here you see there are significant institutions, for example, multilateral donors, regional development banks, bilateral donors, which consist of predominantly the 36 organizations and economic development or OECD country members, foundations, businesses, and recipient countries, which all are part of the global health financing scheme. These organizations contribute to the global health financing structure. In this session, we're going to talk about how global health financing occurs and the multiple characters and their roles that they play in global health financing. Before we discuss global health financing, it's better for us to have a scheme that we can refer to. So I usually refer to this article published in 2019 by McCoy and colleagues, in which they lay out a specific scheme about global health financing. The article developed by McCoy and colleagues published in 2009 divide institutions and organizations into three strata. The first strata are organizations that provide funding. This strata contains governments, private foundations, individuals, and businesses or corporate sector. This, these institutions or foundations, of course, provide specific monetary or funds to support various endeavors in the global health space. The next strata are managing organizations. These contain bilateral ODA agencies, intergovernmental organizations, global health partnerships, NGOs, private foundations, and business corporate sectors. And of course, the last strata contains organizations that obtain funds and spend those particular funds to carry out specific services in the global health domain and, of course, result in specific impact. These contain multilateral agencies and many UN agencies, global health partnerships, specific NGOs, private sector organizations and institutions, governments in low and middle income countries that receive specific funds for specific programs, and of course, civil service organizations in low and middle income countries, and of course, non governmental organizations in those low resource settings. These are the three strata that COI developed in 2009. Although McCoy and colleagues were able to categorize global health institutions into three strata, when it comes to looking at the flow of donations from from organizations to specific areas of health focus, the funding flows are very, very complex. This is an image that has been created by the Institute for Health Metrics, and specifically, this image looks at 2019 and looks at $40 billion in US dollars, and it flows global health financing. So it looks at all sources based on, for example, country and governments. For example, Gates Foundation is here, different governments are here, and it looks at by channels, development banks, European Commission, Global Fund, NGO foundations, and then it looks at specific health funding priorities. So child health, HIV, AIDS, malaria. And you can see this is a specific, very complex picture. So it takes the McCoy picture and makes it more complex. So you can look at the picture from the United States. So this is the funding from the United States. And it goes from the United States in terms of funding from the United States from this area. This is what the United States gives, for example, to other NGOs from here. And then the NGOs give to several different areas. For example, the NGOs and other foundations will give to HIV/AIDS, to child health. And in fact, you can also look at Gates Foundation. The majority of Gates Foundation goes toward, of course, child health. And then you can look at other areas in terms of what the United States government itself gives for HIV/AIDS, and then other diseases, infectious diseases, etc. So as you can see, the picture itself in terms of health area focus is very, very complex. But this tool can actually be accessed at this particular website in terms of looking at the various contributions in terms of focus areas, sources, and channels. The data that I showed you can be accessed from the 2019 Financing of Global Health, published from the Institute for Health Metrics and Evaluation, which is based at the University of Washington, which is actually supported by the Bill and Melinda Gates Foundation. And in fact, this data is also available here, where you can go and see the difference in terms of financing for global health. You can see it at the country level, and you can see it based on different health areas. And of course, as I've stated before, you can access it here. I think it has a lot of useful information in terms of financing at the global health level for a whole host of diseases. So the main objective of financing global health is to improve the health of individuals around the world. There are institutions around the world that want to improve the health of individuals living in low and middle income countries where the average earnings of individuals do not meet the standards in which those countries can really afford to have a robust system to improve the health and quality of life. So there has been a progress and development toward the Sustainable Development Goals, or the SDGs. The SDGs implementation has spurred global health financing. The SDGs are voluntary and country-led. They track the progress in implementing Universal Goals 17 and Targets 169. They build on existing platforms and principles, and basically are based on the principle that no country is left behind. And they build on the country's capacity to implement and report based on the metrics that have been agreed upon. The 17 Sustainable Development Goals, or 17 SDGs, are shown right here in this slide. It is projected that to achieve the health-related SDGs will cost between $134 to $371 billion per year over current spending. For example, the Millennium Development Goals were projected to achieve around $40 to $60 billion per year. That is a price tag of around $58 per each person per year. The share of the GDP spent on health would need to increase to be a mean of about 7.5%. Despite the projected increase in health spending, a financing gap of around 20 to 54 billion per year is still projected. So, although we're still spending a lot in terms of global health, we're still not achieving what we need to spend to truly impact or improve the health of around the globe of individuals that we need. SDG 17 specifically talks about partnerships to achieve the Sustainable Development Goals. And in that specific SDG, it talks about the strength is needed to mobilize domestic resources. And in fact, what we do see is that high income countries give about 0.7% of their official development assistance or gross national income, GNI, to low and middle income countries. As I have shown before, the amount of money that's needed to actually achieve the sustainable development goals has not been met. Even when we factor in the other donations that's been utilized, that's being mobilized within the global health sphere, we're still not meeting what is really needed to achieve the health that is needed around the globe. So, we need to mobilize additional financial resources for low and middle income countries from multiple sources. And we need to actually assist low and middle income economies to attain long term debt sustainability. These are the goals of the Sustainable Development Goals. A recent report by the World Health Organization called Global Spending on Health Weathering the Storm, which was released in 2020, has actually shown that global spending increased from 2005 and continued to increase until around 2014. After 2014, it has decreased and has actually plateaued. So from 2015, global spending has remained around a little bit around $15 billion in terms of US dollars and remains relatively stagnant around that amount since 2018. So we've basically have lost a significant amount of ground in terms of funding, where it was highest was 2014. So in fact, we have lost a lot of funding in the global health sphere in terms of funding. So when we think about official development assistance, ODA is government aid that promotes and specifically targets economic development and welfare of developing countries. It is the gold standard of foreign aid and is the main source of financing for development aid. ODA flows from the Organization for Development Cooperation and Development, or OECD, and the Development Assistance Program. And specifically, it is government funding. It is basically the long-standing target of nations that, and it is specifically that high-income countries should devote about 0.7% of their gross national income, or GNI, to official development assistance program. So we should first look and see what countries actually meet this 0.7%. Now remember, 0.7% is less than 1% of the gross uh, domestic product, or GNI, of any country. So we can look at the ODA, official development assistance of all countries. This right here is the 0.7% target line. And as we can see, for the United States does not meet its 0.7% obligation, along with several other countries actually here. And in fact, most countries do not meet, high income countries do not meet their 0.7%. The United Kingdom meets a 7%, 0.7% target. Remember, this is less than 1% of its gross national product. Denmark, Sweden, Norway, and Luxembourg all actually, starting with Denmark, actually exceed their 0.7%. And remember, this is less than 1% um, exceeded. And in fact, only Norway and Luxembourg exceed their 1% um, givings. The use of good governance themes were used to drive political and institutional reform of a political sort in aid-dependent countries. The multiple definitions of good governance by different donors over time include the World Bank and IMF Group, Asian development banks, and bilateral organizations, including organizations focused on democratization and human rights, and even governance capacities. Good governance indicators from the 1990s to the present, which is what we're in, brought us conditionalities and selectivities, and also commitment to ODA, which was the 0.7% GNP, which we previously discussed. It also brought us the Paris Declaration on Aid Effectiveness, honors, honoring a country's national development plans, SDGs, which were, of course, country led, which replaced the Millennium Development Goals, which were more top down, whereas the SDGs were seen to be more bottom up in many ways. And that's the Addis Ababa Action Agenda for Sustainable Development. Life expectancy around the globe has increased over the past 30 or 40 years, and this has been due to significant advancements and investments in early childhood immunization and also investments in many interventions that has produced quality of life. There has been improvements in for things like in interventions including WASH, uh, prevention of communicable diseases, and treatment of non communicable diseases. All of these have increased lives for individuals around the globe. Now, as people live longer, there's going to be an increase in spending on health per person. As we look at this chart, we can see that as people live longer, they're going to spend more on health. So, spending on health, looking at 1995, was less. Um, and when we look at 2016, as more people live, there's going to be more spending on health. Same with 2030 compared to 2050. Looking back at the data, what we can see is that when we look at government priority in terms of global spending on health, stratified by high, upper middle income, low middle income, and low income countries, we see that when we look at from 2000 to 2018, based on the 2020 WHO report, Global Spending on Health, Weathering the Storm, we saw that for high income countries, actually spending continued to increase. For upper middle income, in fact, spending continued to increase. And I must remind everybody that between these years, there was the recession in which we had that economic downturn. And in fact, we can see that within that economic downturn, we did see that being reflected in lower middle income economies in terms of their health spending. So you can see that right here. And in fact, in lower middle income economies, their health spending has basically plateaued and in fact has decreased from what they spent in 2000 and is in fact less. And in fact, for lower income economies, it's considerably less than what they were spending in 2000. So as we can see, for high income and upper middle income, spending on health has been a priority and it has continued to increase. But unfortunately, for individuals living in either low middle income or low income, spending on health for their governments has not been a priority and has declined for individuals living in these poor countries. When we think about global health financing from the U.S. perspective, there are two key players. Congress. Congress has the power of the purse, they allocate money, and most of the money usually goes in terms of the executive branch. So the executive branch includes usually the White House, and the White House has many specific programs and specifically departments. And the three major departments that or I would say the two major departments where the Congress, where the money goes to, is the State Department here, and it funds programs including PEPFAR, and then of course HHS here, and then it also goes to various programs, including defense, USDA, Treasury, Labor, Commerce, Homeland Security, which funds various global health initiatives, various agencies, including EPA, Peace Corps, MMC, and then various agencies under departments, including CDC, NIH, FDA, HRSA. And then also goes to an independent agencies, including FDA, which funds various programs. This is the global health expenditure by the U.S. government from the years 2006 to what is requested for 2021. So we can look and see that global health expenditure has actually been increasing for the U.S. government, starting with 5.4 billion in 2006, and has steadily increased to around 11.4 billion in 2015, decreased to 10.5 billion in 2016, and has relatively stayed around the 10.5 billion mark until about 2019, where it increased to 11 billion. And then for 2021, it has been requested to be around 20 billion, which is almost a doubling at this point. So the areas in which it's programmed for includes the emergency reserve. We have FPRH, which stands for family planning and reproductive health, which you can see here in the green. We have the global fund. We have global health security right here. We have HIV, malaria, maternal child health right here, NTDs, the nutrition right here, and other public health threats, TB, and vulnerable children, which makes up a very small sliver. The agencies that receive the majority of the global health programming include, for example, the CDC, the Department of Defense, which is DoD, the NIH here. The majority of it is the State Department, as you can see here in the blue, and of course USAID, as I've shown before. And as you can see that, in fact, the U.S. State Department has received the bulk of the funding most of the time in terms of global health funding. And when we think about mechanisms, most of the mechanisms that are used in terms of funding are usually bilateral mechanisms versus multilateral mechanisms. In the previous years, they have been mostly bilateral mechanisms. Only in 2021, now we see more of an even split between bilateral versus multilateral mechanisms. But we will have to revisit the numbers in 2022 to see if truly the allocation was more of a 50-50 split between bilateral versus multilateral mechanisms. PEPFAR stands for the President Emergency Plan for AIDS Relief and is a program that is actually administered by the State Department, and it supports programs in all of these countries that are highlighted here, as you can see based on 2021 diagram. As you can see, the scope of this program is significant, and in fact, PEPFAR has been credited with basically giving access to antiretroviral therapy to over hundreds of millions of individuals and basically prolonging life of people affected with HIV around the world and basically allowing those individuals to live a normal lifespan. PEPFAR is one of the largest single programs within the U.S. HIV portfolio. As you can see, in 2004, it was around $2.3 billion. In 2020, it was 7.3 billion, and in 2021, the allocated or requested is $11.1 billion. In terms of PEPFAR's money, most of it is, of course, HIV. Some of it is allocated toward the Global Fund, and a little bit is also allocated toward HIV relief. And as you can see, most of it has increased. It plateaued somewhat in 2014, 2015, and so forth until around 2017, and has incrementally increased after that. But in 2021, there's going to be a large infusion in terms of funding for PEPFAR. So in the previous slides, you've seen that the U.S. allocates some of its money toward the Global Fund. And the Global Fund's full name is the Global Fund to Fight AIDS, Tuberculosis, and Malaria. And the Global Fund mobilizes and invests more than $4 billion annually to support programs that runs local experts in over 100 countries, and is widely praised for its management and transparency in terms of shifting its priorities. Now, it has put more than 18.9 million people on antiretroviral therapy. It has treated more than 5.3 million people for tuberculosis, and it has actually distributed more than 130 million mosquito nets to protect people from malaria. Because again, it fights AIDS, TB, and malaria, 3 infectious diseases. Some of the criticisms of the Global Fund includes that some of the stakeholders represented on the country's coordinating mechanism may also receive money from the Global Funds, either as the grant recipients, sub-recipients, or private persons. For example, for travel or participation at seminars or contracts. So this basically presents a conflict of interest. But overall, in terms of the Global Fund, many feel that it has done a significant amount of work protecting people from HIV, TB, and malaria. Another organization that you might not heard about, but is very important, is also Gavi, which is the Global Alliance for Vaccines and Immunizations. Gavi is a public-private global health partnership with the goal of increasing access to immunizations in 73 low and middle income countries. It was established in 2000 and works to improve access to new and underused vaccines for children. It supports 17 life-saving vaccines, and I believe that number has increased to over 17 by now. And it has immunized over 760 million children and has saved over 13 million lives. It has generated over 150 billion through economic benefit. The schematic on the right shows the governance in terms of the board of Gavi. Because Gavi uses an innovative public private partnership in which there are different organizations that sit on its governance board, Gavi is one of the unique um, individuals, one of the unique institutions or governance structure within global health. Gavi is a public private partnership that uses a direct contributions, which is 76%, and an innovative financing mechanism, which is around 24%. So Gavi's approach is, in terms of sustainability, is that in terms of immunizations, all countries that support are required to pay a portion of the cost of their vaccines. So co-financing payment are not made to Gavi, but to the vaccine supplier, either directly or through a procurement agency such as UNICEF. And the size of the co-financing contribution is based on the country's ability to pay, as in the measure of the gross national income per capita for the purposes of the co-financing. So it can be anywhere, say, for, let's say, around 20 cents per dose per child um, for the particular vaccination for the lowest income countries. So, and basically, these vaccines are not free, but they are given at a significant reduced cost. So, this is basically accelerating the Gavi to co-financing to transition to 100% self-sufficiency over 5 years if things are going in terms of its financing pledge. So as of 2016 to 2020, donors have pledged 7.5 billion for Gavi, and in fact, the next replenishment is already passed in 2020 to fund from 2021 to 2025, and this co-financing mechanism has seen to be replenished and has seen to be very successful for Gavi in terms of its maintaining its stockpile of vaccines. There are also other organizations that exist to provide financing. So, for example, the Global Financing Facility was established in 2015 to close the financing gap for reproductive, maternal, newborn, child, and adolescent health and nutrition. Funded by the World Bank and governments of Canada and Norway, the United Nations, and other partners, the GFF works within 36 countries. World leaders have pledged 1 billion for GFF in 2018, and it uses modest amounts of grant resources to leverage greater sums for four existing resources: domestic government resources, financing World Bank, and aligned external financing, and also with the private partners. So overall, the GFF has also a profound effect on global financing in these specific key areas that aligns with its mission. When it comes to global health, there are three blocks of countries that we should note: the G7 plus one, which is the G8 and the G20. The core, the G7, consists of Japan, the United Kingdom, the United States, Italy, Germany, France, Canada, which consists of the G7, plus Russia, which makes the G8, and then, of course, the G20, which consists of these other countries. Um, the G8 resolution in Okinawa in 2000 and Genoa in 2001 launched the Global Fund to fight AIDS, tuberculosis, and malaria. So this G8 summit was actually the foundation that launched the Global Fund. And in fact, it was the 2019 summit in Paris that committed to improving access to health for all and strengthening primary health care. And in fact, the G20 collectively has is in the 20th is the 20 of the largest economies formed in 1919 to bring together the important industrialized and developed countries. And the G20 summit in 2019 included the General Declaration committing to advance the global health priorities that lacked, but it lacked concrete goals and targets. But overall, the G20 and also the G7 can have a significant impact in terms of global health depending on the agenda of the leaders at these particular meetings. We can look at the different commitments in terms of direct references or communique, weak or indirect references or no references the G20, the G7, and BRICS countries have made in terms of discussing health SDG goals 3 in terms of health targets. And BRICS stands for Brazil, Russia, India, China, and South Africa. So, for example, when we look at maternal health, the BRICS countries have made strong references or at least one communique in terms of maternal health. G7 also have communicated strong support or direct references. G7 have not. Same with child health, AIDS, TB, malaria, with only a weak or indirect reference to it from G20. And again, for neglected tropical diseases, no mention from BRICS. For G7, there's been a strong reference, and G20 likewise. When we look at, for example, substance abuse, narcotics, no mention from any of these three groups. Same with road traffic or injuries. When we think about sexual and reproductive health, only minor or weak communication from G7. And when we look at tobacco, for example, the tobacco WHO framework, we see that there is a strong commitment and communique reference from BRICS, minor or weak indirect reference from G7, and no communication from G20. So within this constellation of different countries, there are different priorities and different agendas, even on the same topic areas. And some of these countries are within some of these within part of the BRICS and also part of the G20. In terms of looking at official development assistance, looking at data from OECD, and this is actually looking at several different countries. OECD predicts that 28 countries are expected to graduate in terms of their income status by 2030 and expected to move up in their rankings from lower tier to higher income tiers. So this shows us that countries are not relegated to low or lower middle income status. And in fact, given development assistance and the confluence of events, countries can actually move up. Their indicators can improve, their child mortality rate can improve, their incomes can get better, and their development can get better. So these factors are very, very important. And given the right sort of assistance and the right confluence of events, a country's conditions can improve, and in fact, people in that particular country can enjoy a higher standard of living.